So I'm Thornton Kirby, CEO of the South Carolina Hospital Association. I'm with Dr. Brent Powers, who's Chief Medical Officer at Lexington Medical Center. And it's really exciting, Brent, to talk about the work that we've been doing with our physician colleagues across the state toward trying to get them more organized and give them opportunities to talk about things that are relevant to them and shape policy issues in our state.
You know, we've been talking about this for 6 or 12 months now, and it really grew organically. We've been doing a lot of physician leadership and development at Lexington Medical Center, but there is an increasing appetite and need across the state to develop our physician leaders and pull our leaders together in like cohorts so that they can collaborate and work together around issues that are important to them. And so our early targets are essentially physician leaders at each of our systems. So VP of Medical Affairs, Chiefs of Staff, because they hold very unique roles that quite frankly are very lonely roles and unique roles, and they really have no other peers in their given system. Right. Well, the good news is there's systems all across the state, and so they do have peers at the state level. So pulling them together, creating content that's important to them and meaningful to them, that they drive. Because again, the agenda isn't to force feed them with information. The agenda is for them to identify the issues that are important to them, for us to coalesce around and marshal resources to then provide answers that they can use or not use. Again, there's nothing prescriptive about this.
Exactly. So this physician alliance, in our expectation, would be a place for them to convene, to identify issues where they need support or help, and also to weigh in on the policy conversations that are taking place in Washington and in Columbia all the time. And when our careers started, there probably weren't as many policy questions in front of physicians every single day, but they are very much here now, and we want to make sure physicians have a voice. In terms of next steps, we're going to be reaching out to physicians. Tell me about how we're going to do that.
Well, Thornton, we are looking for physician leaders across the state interested in joining with us in this endeavor. Please go to our website to learn more. And if you've not already done so, you can also use the QR code to sign up and designate your interest in serving in one of our 4 working councils: the Clinical Leadership Council, the Physician Policy Council, the Physician Cohort Council, or the Physician Development Council. We look forward to physicians across the state joining us, and early interest and engagement has been amazing.